Hello, I'm Justin Gallagher.
And I'm Sarah Stewart.
Welcome to This Week in Managed Care from the Managed Markets News Network.
In our top story, former CMS Administrator Marilyn Tavenner, who left her post just 6 months ago, became the nation's top healthcare lobbyist this week when she was named President and CEO of America's Health Insurance Plans. AHIP's board announced the appointment Wednesday. Tavenner replaces Karen Ignani, who served as the group's top lobbyist for 22 years before leaving earlier this year.
In Washington, D.C. last week, the House of Representatives voted 344 to 77 to pass the 21st Century Cures Act. The Senate is working on its version. This bipartisan legislation advances big data, strengthens the National Institutes of Health and Precision Medicine, and speeds the FDA approval process. The act promotes research in diseases that range from cancer to MS to ALS. One of the bill's sponsors, Congressman Frank Pallone, a New Jersey Democrat, told AJMC why his co-sponsors, Fred Upton and Diana DeGette, started the process that led to the legislation.
Because they felt that collectively more needed to be done to cure diseases where we haven't really made much progress. And they basically, our committee, or the health subcommittee of the Energy and Commerce Committee, went around the country and basically had hearings and forums and tried to get ideas, in the hinterland, so to speak, about what should be done. A lot of the input came from I would say disease-centered groups, that focus and raise money and ask for more research on a particular disease, for example, ALS, for example.
There was much controversy in late 2013 when the American Heart Association and the American College of Cardiology issued new guidelines that called for more Americans to take statins. But it looks like good advice based on research published this week in JAMA. Studies found the new guidelines for cholesterol medication are efficient and cost-effective. In one study, the researchers looked at 10 years of data on 2,500 people who were not taking statins. Under the new guidelines, statins would be recommended for 39% of them, compared to only 14% under the old guidelines. Over the time period, 74 people had cardiovascular events, such as heart attacks. A closer look showed cardiac events were more common among those who would have taken statins under the new guidelines, but not under the old ones. Researchers say this shows the new guidelines will more accurately predict who needs statin therapy.
CMS announced this week that its efforts to prevent fraud are working. Investments that were a part of the Affordable Care Act, which allow Medicare officials to collect and interpret data, prevent millions in improper payouts from being paid, acting CMS Administrator Andy Slavitt said this week. Slavitt announced that the 3-year total for the fraud prevention system is now $820 million, including $454 million just for calendar year 2014. Said Slavitt, very few investments have a 10-to-1 return on taxpayer money.
In February, the Dietary Guidelines Advisory Committee expected strong reactions when it recommended that Americans eat less red and processed meat and have diets based on principles of sustainability. Committee members learned just how unhappy the food industry was with its report. This week, a Senate subcommittee added a provision to a spending bill that effectively blocks the Department of Agriculture from acting on some recommendations. Critics of the beef industry in particular say senators from the Midwest and Western states are using the political process to overturn the scientific process. A member of the Dietary Guidelines Advisory Committee, Dr. Frank Yu of Harvard, spoke about the reaction to the report at our recent conference, Patient-Centered Diabetes Care.
Another major development, as I mentioned earlier, is to consider environmental impact of food production and food consumption. So the committee recommends reducing red meat for improving human health and also improving the health of the planet. So this is really a groundbreaking recommendation. And of course, we met huge resistance from the beef industry or from the meat industry. But we're not talking about, vegetarian diet. We are talking about just reducing the current consumption level of red meat and processed meat, and for the benefits of human health and also reducing environmental impact of food production.
Finally, a featured article in the American Journal of Managed Care finds evidence that judging health plans on how well they promote medication adherence might be a way to improve health outcomes. One way to do this, according to the study from USC's Schaefer Center, is to connect health plan adherence to reimbursement. The study, led by Seth Seabury, can be found at ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher.
And I'm Sarah Stewart.
Thanks for joining us.